Hey everyone, it's Amazing World and welcome back to the channel. Today we're diving deep into a topic that's close to all of our hearts, our health. Ignoring these warning signs is like hitting the snooze button on a potentially serious issue. Remember, I'm not giving medical advice here, just opening up the conversation about some common warning signs that should always be checked out by a medical professional. So, if you're ready to become more in tune with your body and learn about 10 warning signs you should never ignore, hit that like button and let's get started. Have you ever stepped on the scale and noticed a significant drop in weight, even though you haven't been trying to lose any? Dr. Smith. Unexplained weight loss can be a sign of a variety of underlying health issues, some more serious than others. It could be something as simple as a change in your metabolism, or it could be a symptom of a hormonal imbalance, like an overactive thyroid. In some cases, unexplained weight loss can even be a red flag for more serious conditions like cancer, diabetes, or digestive disorders. If you notice you've lost more than 5% of your body weight within a 6 to 12-month period without any changes to your diet or exercise routine, it's crucial to make an appointment with your doctor. They can run some tests to figure out what's going on and determine the underlying cause. Remember, early detection is key when it comes to most health conditions, so don't brush off unexplained weight loss as no big deal. Your health is worth investigating. We all feel tired from time to time, right? Life can be exhausting. But there's a big difference between feeling tired and experiencing persistent, unrelenting fatigue. Patient 1. Persistent fatigue can manifest in many ways. You might feel physically exhausted, mentally drained, or a combination of both. You might have trouble concentrating, feel weak and sluggish, or find it difficult to get through your daily routine. Persistent fatigue can be a symptom of a wide range of health issues. It could be related to lifestyle factors like stress, poor sleep habits, or nutritional deficiencies. But it can also be a sign of underlying medical conditions such as anemia, thyroid disorders, heart disease, or even depression. If making lifestyle changes doesn't improve your energy levels, it's important to consult with your doctor. They can help rule out any underlying medical conditions and create a personalized plan to help you regain your energy and vitality. Take a moment to pay attention to your breathing. Is it easy and effortless, or do you find yourself gasping for air? Shortness of breath, also known as dyspnea, is a feeling of air hunger or difficulty breathing. Dr. Smith. If you experience shortness of breath suddenly, or if it's accompanied by chest pain, dizziness, or confusion, call 911 immediately. These could be signs of a medical emergency like a heart attack or pulmonary embolism. In less urgent situations, shortness of breath can still be a sign of an underlying health issue. It could be related to respiratory conditions like asthma, pneumonia, or chronic obstructive pulmonary disease, also known as COPD. Other possible causes include heart problems, anemia, obesity, or anxiety. If you're concerned about shortness of breath, don't hesitate to talk to your doctor. They can evaluate your symptoms, perform a physical exam, and order tests to determine the cause. Our bodies are pretty amazing, aren't they? They have this incredible ability to fight off infections and heal themselves. Health expert. A fever is actually a natural and healthy response to infection. It helps create an environment that's less hospitable to those harmful microbes. But while an occasional fever is usually nothing to worry about, frequent fevers can be a cause for concern. If you find yourself running a fever regularly, it could be a sign that your body is battling an infection that just won't quit. It could also indicate an underlying inflammatory condition, an autoimmune disorder, or even certain types of cancer. Health expert. If you experience a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher on multiple occasions within a few weeks, it's definitely time to check in with your doctor. Let's talk about something nobody really wants to talk about: poop. Your digestive system plays a vital role in your overall health, and changes in your bowel movements can sometimes be a sign that something's not quite right. Patient 2. We all have our own normal when it comes to bowel movements. Some people go once a day, others a few times a day, and some every other day. The key is to be aware of what's normal for you and to take note of any significant changes. If you experience persistent diarrhea, constipation, changes in stool color or consistency, blood in your stool, or abdominal pain, it's important to talk to your doctor. These changes could be caused by a variety of factors, including infections, irritable bowel syndrome, inflammatory bowel disease, or even colon cancer. Patient 2. Don't let embarrassment keep you from seeking medical attention. A cough is our body's way of clearing our airways of irritants like dust, smoke, or mucus. Dr. Smith. While an occasional cough is usually nothing to worry about, a persistent cough that lingers for weeks or even months can be a sign of an underlying issue. If you have a persistent cough, it's important to pay attention to the characteristics of your cough. Is it dry and hacking, or is it productive, bringing up phlegm? A persistent cough could be caused by a variety of factors, including allergies, asthma, respiratory infections, acid reflux, or even certain medications. Dr. Smith. In some cases, a persistent cough can be a sign of a more serious condition like lung cancer, especially if you're a smoker or a former smoker. If you're concerned about a persistent cough, don't hesitate to make an appointment with your doctor. They can evaluate your symptoms, perform a physical exam, and order tests to determine the underlying cause. Treatment will depend on the underlying condition. Pay attention to any new moles, growths, or sores that appear on your skin, especially if they change in size, shape, or color. Also, be on the lookout for any persistent rashes, itching, dryness, or discoloration. Health expert skin changes can be caused by a variety of factors, including sun exposure, allergies, infections, hormonal changes, and certain medical conditions. Some skin conditions like eczema and psoriasis are chronic and require ongoing management. If you notice any unusual or persistent skin changes, it's important to see a dermatologist or your primary care physician. They can evaluate your skin, determine the cause of the changes, and recommend the appropriate treatment. Difficulty swallowing can range in severity from mild to severe and can make it challenging to eat and drink properly. If you experience pain, choking, coughing, or a sensation of food getting stuck in your throat or chest when swallowing, it's important to seek medical attention. Dr. Smith. Difficulty swallowing can be caused by a variety of factors, including acid reflux, infections, nerve disorders, muscle disorders, and even certain types of cancer. In some cases, difficulty swallowing can be a sign of a more serious condition like a stroke or esophageal cancer. If you're concerned about difficulty swallowing, don't hesitate to talk to your doctor. They can evaluate your symptoms, perform a physical exam, and order tests to determine the underlying cause. Treatment will depend on the underlying condition. Pain is our body's way of telling us something's wrong. Concerned friend. While some pain is short-lived and easily explained, like a pulled muscle or a headache, unexplained pain that persists or worsens over time should never be ignored. Unexplained pain can manifest in many ways. It could be sharp or dull, constant or intermittent, localized or widespread. Concerned friend. The causes of unexplained pain are as varied as the types of pain itself. It could be related to an injury, infection, inflammation, nerve damage, or an underlying medical condition. If you're experiencing unexplained pain, it's essential to talk to your doctor. They can help determine the underlying cause of your pain and recommend the appropriate treatment. Our vision is a precious sense that allows us to experience the world around us in all its vibrancy. Health expert. While some age-related vision changes are normal, sudden or significant changes in vision should always be checked out by an eye doctor. Changes in vision can manifest in many ways. You might experience blurry vision, double vision, floaters or flashes of light, halos around lights, loss of peripheral vision, or difficulty seeing in low-light conditions. Health expert. These changes could be caused by a variety of factors, including refractive errors, age-related macular degeneration, cataracts, glaucoma, diabetic retinopathy, or even neurological conditions. If you notice any sudden or significant changes in your vision, don't wait to see an eye doctor. So there you have it, 10 warning signs your body might be sending that you should never ignore. By paying attention to these warning signs and seeking medical attention when necessary, you're taking a proactive approach to your health and well-being. Early detection is key when it comes to most health conditions, so don't hesitate to reach out to your doctor if you have any concerns. Thanks for watching, and remember to take care of yourselves and each other. Until next time, stay healthy.